Measles, a disease so contagious that one infected person can spread it to nearly everyone around them. For centuries, it has taken millions of lives, and even today, it's making a dangerous comeback. Could measles really return as one of the deadliest diseases of our time? Stay with me as we uncover the shocking truth. When you hear the word measles, what comes to mind? Perhaps a mild childhood illness with a telltale rash. However, behind this seemingly innocuous disease lies a sinister secret that has the potential to turn everyday life into a nightmare. Measles is not just a rash or a childhood illness. It's a highly contagious viral infection caused by the rubella virus. Once it enters the body, it attacks the respiratory system and spreads quickly through the bloodstream. Unlike the common cold, measles doesn't just make you sick for a few days. It can cause lifelong complications and, in some cases, death. That's why health experts consider it one of the most dangerous viruses in human history. Now let's take a journey back in time and explore the origins of this menacing virus. The story of measles dates back over 1,000 years. The earliest known description of the disease was written by a Persian doctor in the 9th century. For centuries, measles swept through communities in terrifying waves, killing millions of children and leaving families devastated. It was a dreaded visitor in every household, striking fear into the hearts of parents and caregivers. During the Middle Ages, people had no idea why this terrible illness kept coming back to haunt them. They didn't know that measles was hiding in plain sight, silently waiting to strike. Back then, doctors were clueless. No effective treatments existed. All they could do was watch helplessly as their patients suffered and succumbed to the disease. The only thing they knew for sure was that measles wasn't picky about who it attacked. Rich or poor, young or old, it spared none. It was a ruthless equalizer that left no one untouched by its wrath. But the dawn of the 1960s brought a glimmer of hope. Scientists finally figured out how to fight back against measles. Enter the measles vaccine, a medical marvel that was about to change everything. With the vaccine's introduction, cases dropped dramatically. By the early 2000s, many countries declared measles eliminated. But here's the twist you didn't see coming. Despite the vaccine's success, a sense of complacency crept in. People began to think that measles was a thing of the past, a relic of the distant past that had no place in their modern world. But guess what? Measles never went away. It just took a backseat while the real troublemakers took center stage, and now it's making a shocking comeback. But why? Why is this ancient disease rearing its ugly head once again? Well, the answer lies in a perfect storm of misinformation, declining vaccination rates, and global travel. People started to question the safety of vaccines, falling prey to online rumors and unfounded fears. Measles, along with other vaccine-preventable diseases, began to resurface, causing outbreaks that threatened to overwhelm hospitals. And if that's not enough to send chills down your spine, consider this. Measles has an incubation period of about 10 to 14 days, meaning infected individuals can spread the virus without even knowing they're contagious. It's like a ticking time bomb that doesn't explode until it's too late. You might be wondering, how bad can measles get? How many people does it affect and how many lives does it claim each year? According to the World Health Organization, WHO, in 2022 alone, there were 40 million cases of measles worldwide, resulting in 20,000 deaths. In the United States, measles cases have reached their highest level in over a decade, and the numbers are expected to continue climbing. Now let's talk about the biggest nightmare scenario. What if there's a measles outbreak in your community? How would you protect yourself and your loved ones from getting infected? Let's say you step into a crowded subway car not knowing that within that confined space, a measles patient is quietly spreading the virus. You breathe in the air they leave behind, totally unaware that you've just been exposed to the measles virus. Over the next 2 weeks, the virus incubates inside you, multiplying and preparing to strike. Then it happens. You start feeling like you have a common cold, maybe a fever, cough, a runny nose, and red, watery eyes. At first, you think it's just the flu. But then those telltale white spots appear inside your mouth, followed by the distinctive red rash that spreads across your body. You've got measles, now it's up to you to act fast and stop the chain of infection. If you suspect you have measles, don't waste any time. Immediately isolate yourself and contact your healthcare provider. Tell them about your symptoms and ask for a test. Remember, early detection is key to preventing the virus from spreading further. Now, you might be thinking, well, I'm young and healthy, I can probably fight it off. But here's the harsh reality. Measles doesn't care about your age or health. It attacks all comers and can lead to serious complications. Pneumonia, brain swelling, and permanent hearing loss are just some of the potential consequences of this highly contagious disease. So don't take chances, protect yourself and others by seeking medical help right away. But what if you're worried about the vaccine? Some people hesitate to get vaccinated against measles due to unfounded fears and misinformation. But let's address these concerns head-on. Vaccines are one of the safest and most effective ways to prevent the spread of infectious diseases. They work by triggering your immune system to produce antibodies against specific viruses. When you get vaccinated against measles, your body learns to recognize and fight the virus, providing immunity that can last for years. Vaccines have saved countless lives and eradicated deadly diseases such as smallpox. By choosing to vaccinate, you're not just protecting yourself, but also contributing to the safety of your entire community. Some people may argue that natural immunity acquired through a previous infection provides stronger protection than vaccines. However, this viewpoint overlooks the risks involved. Natural infection means facing the full force of the virus without the benefit of medical intervention. It puts your health in the hands of fate and could potentially lead to severe complications or even death. Vaccines offer a controlled and safer way to develop immunity, allowing you to gain protection without risking your well-being. But let's delve deeper into the science behind measles vaccines. There are two main types of measles vaccines, the first being the MMR vaccine, which protects against measles, mumps, and rubella. This vaccine is typically administered into doses, the first at 12 to 15 months of age and the second during the preschool years. The second type is the single measles vaccine, which is used in areas where the MMR vaccine is not available or recommended. Both vaccines have undergone rigorous testing and are proven to be safe and effective. They contain a weakened form of the measles virus that cannot cause disease but still stimulates the immune response. Getting vaccinated is a simple and painless procedure that usually involves an injection. It's important to follow the recommended vaccination schedule to ensure optimal protection. While vaccines are highly effective, there is a small chance that some individuals may not develop immunity after vaccination. In such cases, alternative methods of protection, such as avoiding contact with infected individuals or wearing protective clothing, should be considered. However, it's crucial to remember that vaccines significantly reduce the risk of infection and transmission. Imagine you're planning a trip to a country where measles is prevalent. To protect yourself and others, you can take several precautions. First and foremost, ensure you're up to date with your measles vaccinations. Check your immunization records and get the appropriate vaccine if needed. Secondly, practice good hygiene. Wash your hands thoroughly and frequently, especially before eating and after using the restroom. Use alcohol-based hand sanitizers when soap and water are not available. Additionally, avoid touching your face, nose, and mouth, as this can transfer the virus from your hands to your body. Thirdly, be cautious about sharing personal items such as utensils and towels with others. These items may come into contact with an infected person's saliva or skin, increasing the risk of transmission. Finally, monitor your health closely upon returning home. Even if you don't show symptoms during your trip, it's possible to develop measles upon returning home. If you experience any signs of illness, immediately contact your healthcare provider. These precautions may seem inconvenient, but they are essential in preventing the spread of measles. By taking these steps, you can help safeguard both your own health and the well-being of your loved ones and the wider community. Remember, one infected person can spark an outbreak. And by protecting ourselves, we create a shield that stops the virus in its tracks. And if you want to dive even deeper into the world of infectious diseases and public health, I've got a treat for you. So click the link below and embark on a journey filled with fascinating insights and expert perspectives. Your curiosity knows no bounds.